Welcome to this going forward update on the 13th of August 21. And we've set this up as an extra update during the holiday period because we felt it was necessary due to some of the concerns around vaccinations for 12 to 15-year-olds. So we're going to have an update by Sharon about DSEngage. It's for everybody. Talk a little bit about vaccinations and then a little bit of blog news, some nice news at the end. We're joined today by representatives from the Down Syndrome Medical Interest Group of UK and Ireland, Dr. Sheila Purry, the chair, Dr. Jill Ellis, the vice chair, and Dr. Elizabeth Herivane. And with that, I'd like to hand over to Sharon.
Hi, good afternoon, everybody. I'm always happy to talk about DSEngage. It has absolutely become my favourite subject over the last year. So just to remind you of what we have got for you, in case you haven't noticed it over the summer. So DSEngage, in case anyone doesn't know yet, is a whole programme of activities that help to keep all of us busy and healthy and active and to give us something to do when maybe other things are not running normally. So now we have a complete channel of activities that you can have fun with, online videos on YouTube that you can do at any time, either at home or even when you're on holiday, because you can access them from anywhere if you have some device. And there's everything there: workouts, yoga, dance routines, lots of arts and crafts. So things that anyone will enjoy. So you can go to our channel and find something to enjoy anytime. And as well as that, we also have some live sessions on Zoom. So if you want to do things with other people at the same time, then you can on Zoom. And over the summer, we haven't had our full weekly program, but we still have some things, which I'll tell you about in a minute. So you can join in those. All of them are great fun. Honestly, nobody has never not enjoyed a DSEngage activity. So just join in and give it a go. I guarantee that you will enjoy it. You'll see the picture here on this slide. This is Graham, one of our very regular people at the disco, doing his Michael Jackson impression and loving it. So I love that. It's one of my favorite pictures. Okay, so let's go to the next slide and you'll see the summer. So in the summer, we've had some summer holiday special dance sessions. I was literally in a salsa session just before this session. They're really good fun. Anyone can join in, people of all ages, all abilities. They're on a Thursday and a Friday afternoon, but next week is the last week. So if you haven't joined in yet, then definitely join in next week. So the theme of next week's is musical theatre week. So it's going to be really, really good fun. Lots of different dance steps, but you can do as much or as little as you like, and you'll definitely enjoy it. You can sign up on our website. So if you are around Thursday, Friday afternoon next week, then just sign up on the website and join in with that. You'll love it. And also going on in the summer, on the next slide you'll see, is our favourite workout person, Mr Motivator. So Mr Motivator is so much fun. His workouts are so much fun. They are every Wednesday evening at 6:30 p.m. So Mr Motivator hasn't stopped at all for a summer break. So you can join in with that Wednesday at 6:30. He's so funny. Honestly, it's like a live comedy routine and a workout. So you don't even notice that you're doing the workout. So join in and give that a go. You will enjoy that. And the next slide is just to show you something new we tried in June. And this was our clay course. It's a 4-week course in an evening where all the participants get to make something from clay. As you'll see, this is some of the finished products. It's a really good course and you get provided with all the equipment you need and a DSA pottery apron to go with it. So it was really enjoyed. We had lots of good feedback from the course in June. So there's going to be another one in October. So if you would like to join in that, look out for it on our website and then you can join in with it in October and make something beautiful like the things here. And the next slide is just to remind you, from the 6th of September, we'll be back to our full weekly timetable. So this timetable, again, is on the website. You don't have to memorize it, but there'll be something every day of the week. Live events for you to join in with every day of the week, and the on-demand YouTube channel events too. So be excited. People were even emailing today to say, when is it coming back, the full weekly timetable? So we're really happy about that. You can join in from September. And the final slide, just another idea for you. This is especially for people who live probably in Wales or Scotland or somewhere where it rains at the weekend, and you're thinking, what can I do on the wet weekend? We have some other weekend bonus activities, things like colouring sheets, puzzles, quizzes, and word searches. This is one of my favourite word searches. So you can download that from the website, have a go at the word search, even if you can't go outside so much if the weather's not great. So hope to see some new people at some events soon. Thank you.
Thank you, Sharon. Please, could you say out loud where to find the activities? Because we've had a question about that.
Yes.
If
you go to the Down Syndrome Association website, so it's downs-syndrome.org.uk. And if you look under Our Work, there's a tab called Our Work. You'll see DSEngage, and then you can sign up for anything, download anything, and join in.
Thank you very much. That's super. And now I'd like to pass to Julian.
Okay, afternoon, everybody. As Jill mentioned, one of the main reasons for having this update during the August break was to keep you up to date with developments relating to the rollout of vaccination, COVID-19 vaccination. Quick recap, as most people will remember, adults with Down syndrome were at priority group 4, young people with Down syndrome aged 16 to 18 were at priority group 6. So they have all been eligible for vaccination for quite some time now, and hopefully have all been double jabbed. There was a development a few weeks ago, which you I'm sure will have covered in the news, and we've had lots and lots of calls to our helpline about this. Younger children, so children in the age group 12 to 15 who have Down syndrome, are now eligible for their vaccination, and we're going to talk a little bit about that in a moment. If you have specific questions, I'm not going to talk anything about the sort of health specific information. That's why we're very pleased to have our colleagues from DSMIG. So if there is a particular question that you have about the vaccination and you want to ask that of our medical colleagues, then do put those into the question and answer, and we'll be coming to those in a moment. So yes, please do that.
Thanks, Julian. Just to say, we won't be taking them from the raised hand box, so please don't use that. Just put them straight into the Q&A box. Thank you.
Thanks. And then I think the next slide will take you through the recent sort of timeline. If we move on to the next slide. Okay. Sorry.
Are we on the right one?
Yes,
Are you sure?
That's it. Yeah,
okay.
That's lovely. So, sorry, no, back one. We jumped to one. I think that's it. So back in June, there was an announcement from the MHRA, which is a body that regulates and licensed drugs and medical interventions in the UK, and they gave a positive review of the safety of COVID vaccination, the Pfizer vaccination for children in the age group 12 and above. And then the JCVI, which advises the government about vaccinations and immunisation, then took another 5 or 6 weeks to look at emerging data from other countries. So America, some other countries in Europe have been quite routinely vaccinating younger children, and they wanted to look at that data, and then they made their announcement on the 19th of July that there were a particular group of children, which we'll look at the actual announcement on the next slide, that would now be eligible for COVID-19 vaccine. So I think the next page actually gives the statement. So the advice was that children aged 12 to 15 who have severe neurodisabilities, then another group children with Down syndrome, and then another group children who were immunosuppressed, and then children that would meet the criteria of having a multiple or severe learning disability. And this advice is given to governments in England and Wales. And then there is an established relationship within Northern Ireland and Scotland that they will follow the JCVI advice. So it does apply across all nations of the UK. And so a letter was sent out a few days after the JCVI announcement to every GP practice and Director of Public Health across all the various areas of England and Wales. And the actual statement said that each local area must now put in place a delivery plan of how they're going to offer a vaccination to these younger children. And the key information is that children should be offered their first dose, because obviously you need to have 2 doses of the vaccine. So the first dose should be offered before children return to school in September. And we're aware of the fact that that deadline is creeping up very quickly. And it is expected that every area will have an operational plan ready to go by the week commencing the 23rd of August at the latest. Now, I think we were reading into that and hoping that that would mean that the rollout would begin pretty much imminently. And there are a couple of reasons perhaps why there's been a delay, which we'll just have a look at now on the next few slides. So what families have been telling us, and we had a huge upswing in calls to our helpline and lots of activity on social media from families saying that either their local GP didn't seem to know about what was happening, or there was confusion, or even more frustratingly, families were being invited to go for their vaccine, and then those appointments were cancelled. And obviously there was quite a degree of bewilderment why that might be. There are some families who have got younger children who have been vaccinated, and there is leeway. There's always been provision within the system for clinicians to make what's known as a PSD, which is not part of the general vaccine rollout, but it would be an individual clinician, designating an individual child or an adult as being eligible, and then taking responsibility for administering the vaccine. So the small number of children who probably have already been vaccinated have been done under that PSD heading. So moving on, I think, to the next slide, we picked up probably about two to 3 weeks ago that there were issues. So we very quickly engaged with some top people. We've been fortunate enough to have the ear of the head of vaccine deployment at NHS England. There is a lead for children, and also the head of learning disability and autism services. So we've been in regular email contact with them over the last couple of weeks, very clearly, raising the profile of people who have Down syndrome and saying it's really important that this now happens, now that JCVI guidance has been issued. And particularly, I think, stressing the importance of this need to get children their first vaccine before they start back at school. There's this window of opportunity now over the next month before children begin mixing again in large numbers, and it just seems sensible that everybody gets that vaccine as quickly as possible. So some things that we know, and I think that's the next slide that we can, so what we know is the initial pledge. So the information that's in the letter dated the 22nd of July still stands. That hasn't been changed, because I think there was some feeling, and some families were being told by their GP that the JCVI guidance had changed, or that government guidance had changed, and that isn't the case. It's just an operational issue. And we seem to think that there's been such huge deployment necessary over the last 6 months or so in terms of a vaccine rollout, that a whole range of people have been involved in that. Some of those will be consultants, GPs, clinicians, others might be allied health professionals or volunteers. And there is a particular process, mainly around training for those individuals, to make sure that they have the right skills to now deal with a different group of patients. So these will be children, not adults. Children who have a learning disability, so there'll be particular training around communication and dealing with some of the issues around making reasonable adjustments, and also making sure that indemnity is in place for all of those people. So that process, I think, has taken a little longer in certain areas perhaps than we might have hoped, but it is moving forward, and we're very hopeful now that things will happen fairly quickly within the next two or so weeks.
Right, thank you, Julian. You had finished, hadn't you, there?
Yes, yeah.
Okay, right. Well, you know, we are very pleased to have Sheila, Jill and Liz with us from the Down Syndrome Medical Interest Group. And you can read their latest news update, which has gone up today on the website link. So if Sheila and Jill and Liz would like to put their cameras on, and I'm going to pause the presentation for now so that we can see you, and we'll begin to look at the questions. So do you start typing questions in, or as they occur to you? And the first one is there any new evidence on the severity of illness for children under 16s with Down syndrome, but with no comorbidities? And then it says, looks like all children with Down syndrome are being considered at higher risk regardless of individual health, ?
So the evidence that we do have is from the T21RS group, but that data only also relates to the first lockdown period, so that data is only involves looking at children till June 2020. And a lot of people sort of feel, well, our behaviors were very different at that time, so can we extrapolate it? But I think we can. So with regards to the severity, all that we know from that data is at that time, where we also need to be mindful that the data, 43% of the data was collected from India and Brazil, and only 11% was from UK and 9% from the US. And in that cohort, children, sort of particularly teenagers above the age of 14 were at a greater risk of developing symptoms of COVID-19. And the risk was much less for children under the age of 5. The findings suggested that the risk factors was age, obesity, epilepsy, and thyroid disorders. But out of that cohort also, it was sort of low-income groups, but countries that the data was collected from primarily. But even in those groups, the risk was less, but it still was there. And I think, you know, a lot of people have asked why have people with a severe intellectual disability been included in the group that are eligible, and that is primarily because, not because they're more immunosuppressed or they're at a more risk medically, but it is more because if they were to develop symptoms and they were hospitalized, their experience in hospital is much worse. And we do need to protect them from that experience. So it's not just from a medical perspective, but it's a holistic experience why we do want to protect the population, really. So I don't know whether that's answered the question or have I waffled.
Nope, thank you very much. I'll move on to the next question, unless Liz or Jill wanted to add anything, do chip in. But the next question is, what would the risk of both COVID and the COVID vaccination be for a healthy 14-year-old girl with Down syndrome who has a few well-managed autoimmune diseases, thyroid, celiac and alopecia, but is otherwise incredibly healthy and fit? And the parent is trying to weigh this up.
Personally, I do feel that the vaccination does help prevent severe disease. So if she was my child, particularly with the presence of an autoimmune disorder such as thyroid disorder, I would sort of say, I would certainly say that she should receive the vaccine. Her risks is lower than an adult, but she still has a higher risk than a typically developing child without any additional health issues of getting COVID-19. So I do think she is at a higher risk than the general population, and particularly with the presence of thyroid disorders. Would you say that's right, Liz? Yeah.
I would agree. Also, I think. Yeah, you go for it. Sorry, Jill. You go for it.
Yeah, I would agree that there's, as well as the risk of serious illness with COVID-19 itself, there's also not a huge amount known still about how much at risk our children might be from things like PIMS, TS, the immunosuppressive illness, also with long COVID. And then there's the whole issue about being away from school, having to isolate, which will have a big impact on other areas of somebody's life as well. So I think the vaccination pros will far outweigh the risks.
And I just wanted to talk briefly about the risk of the vaccination on the other side of that, which is really incredibly low. And we know that when giving this Pfizer vaccine to children, there have been some reports of heart inflammation, but they're usually in boys under 25. So I would say for a 14-year-old girl with Down syndrome, very, very rare. And it's certainly, and we don't have the numbers to put on that because they're just not enough around to really know the levels. So I think that there are some risks for the vaccine, but they're tiny. And I think I wouldn't worry too much about it. I don't know what you think, Liz.
Absolutely. I'd back that up. I was just looking at papers earlier on today, and the highest risk of heart complications in a paper that I've read was 12 children or 12 young people in 1 million cases. So it's really, really vanishingly small. Whereas the risk of those same cardiac problems in people because of COVID rather than because of the vaccine were about 700 in a million. So your chances of having those kind of complications are far higher with the disease than with the vaccine.
Just to add to that, a lot of people are worried that if their child has an underlying heart condition, whether that would increase the risk of this heart inflammation and complication. And there is no evidence that that would be the case. So if your child does have an underlying heart condition, that does not make them more susceptible to this really small risk of pericarditis and or the heart inflammation or myocarditis, really. So I would definitely recommend giving it. We can't obviously in medicine give 100% guarantee at any stage, but life is about weighing up risks and benefits. And personally, I do feel that there is much more benefit of receiving the vaccine than not receiving the vaccine.
Thank you. Now, a different angle from the next question. Do we know if they are actually doing the training? Is it up and running from National Service for local areas? I'm very concerned that the 23rd of August doesn't give 2 weeks clear from vaccine before schools go back. Yes.
I think each area is different. Each area is very different, and it's very hard for us to say what's happening in each and every area. And I think there's some areas that are a bit more advanced with their training, and some areas not. And we're really sorry that it does seem like a postcode lottery, but that is the fact that some places are being a bit more proactive and some places have not been so proactive. And it's also the summer holidays, so a lot of healthcare professionals have also taken holidays. So it's just really, really hard, and it's really challenging. So when I attended our Royal College of Pediatrics meeting, and we were discussing the practicalities of it, and we was, you sort of say, should there be walk-in centres? Should it be offered in special schools, or what would be the best way forward? And I don't think there has been a clear operational rollout, and our Royal College of Pediatrics and Child Health have been pressing the JCVI to bring us some sort of things around the operational rollout to make sure that does happen from the 23rd of August. Certainly in Leeds, where I'm based, some of our schools are opening a bit later, so maybe they'll have a bit more time to ensure that they get their vaccine before they go back to school. Really, I don't know what's happening in other parts, but our special schools are certainly not opening before the 9th of September, quite a few of our special schools, so that gives them 2 weeks, really.
I think it is incredibly frustrating. As some of you will know, I'm a parent as well as a doctor, and my daughter's 15 with Down syndrome, and I've been going around the same circles that everybody else has been going around trying to get her a vaccine. And I think So it is very frustrating, particularly around the variation across the country. There are some areas where children have been able to get them, and that's fantastic, and other areas where we feel like we're banging our heads against a brick wall. It will vary an awful lot depending on local setups. So if the vaccinations are done within a GP surgery by paid staff as part of their paid role, then they will have had all the training already, because they already give vaccinations to children for other things. My local GP surgery, for example, they do run the vaccines, but they're not using their paid staff. They're using volunteer staff, so retired doctors and nurses, people who have got healthcare qualifications but have volunteered to do this role. Because of that, they've had fresh training to be able to vaccinate all the adults, and now we'll have to go through training processes. So it's not just around the vaccination itself, but things like safeguarding children training, learning disability training, pediatric life support training. We're not expecting anybody to need to use any of that, but it's the boxes that need to be ticked for somebody to be able to give vaccinations to a child. And if it's a paid member of staff in a paid role, they already have it. If it's a volunteer, then they don't. And so that all needs to be caught up with. And I think that's why there's quite a bit of variation.
Well, you're ahead of the next question, but I'll read it out anyway to see if you've got anything else to add. The issues of training aren't relevant for our cohort, though, because the directive says that 12 to 15, and then it does say critically extremely vulnerable, but will be offered jabs via their primary care settings and at hospital appointments. The GPs have all the safeguarding in place because they already administer the childhood vaccination scheme. So doesn't this stack up for our community? Question mark.
As I say, locally it doesn't, unfortunately. In our CCG area, I know some GP surgeries that have been doing their own Pfizer vaccines for their own cohorts and using their paid staff and paid hours, whereas, as I say, my GP surgery isn't. So is it really variable depending on the situation locally? So again, to use my GP as an example, they are going to put together a clinic run by their paid staff in their paid hours because they will be trained. Whereas for a different GP setup, it might be very different. Hospitals is a different setup again, because those staff so far may well have been adult trained staff because they've been vaccinating adults. And so although it would seem very sensible to vaccinate children as they turn up for outpatient appointments, you still need the right staff in the right place at the right time to do it.
Thank you. Now we have some great questions coming up. The next one is, what is the incidence of severe life-threatening reaction to vaccines in children?
Well, almost completely nothing. There is the only severe life-threatening reaction you could possibly have, I think, would be an allergic reaction where you have a sudden mass allergy. Now with COVID vaccine, those allergies have been very low. We haven't had very many of them at all, and I've certainly not seen any in the younger people we've been vaccinating. I've been working in a vaccine centre 1 day a week since COVID went, and we've had no one really have an allergic reaction. We're vaccinating 1,000 people a day when I'm there. So I think that is very low. Apart from that allergic reaction, there is nothing. There are no other life-threatening effects. This cardiac myocarditis in the 12 cases per million that there have been, it's all been mild and all resolved with no long-term issues. So I think there is none that I'm aware of, unless the others would like to say.
No, right, great. On to the next question. Is there anything being done to get siblings of children who have Down syndrome a vaccine, especially the siblings of those who are with Down syndrome who are under 16 and who are vulnerable?
Again, I think it is a very variable, and it is how each GP practice may interpret the JCVI recommendations, because the JCVI recommendations are that siblings of and actually children of parents who are immunocompromised above the age of 12 should receive the vaccine. As we said before, that our children who have Down syndrome, majority of them are not immunocompromised unless they have sadly receiving chemotherapy for cancers or any other reason, and they're on immunosuppressed drugs. They're not actually severely immunosuppressed, but it is very variable how somebody interprets it. We had a discussion just before this about what would somebody interpret it. And I spoke to some GPs, and some GPs are offering it. And in the last week, I've spoken to some of the siblings of some of our children. And I think because they are generally healthy, and the college discussion was very much so that we should be asking the young person's opinion themselves as well as the parents. And I think that's fair enough, because the reason why they're receiving the vaccine is to protect their sibling. So they should have a say in it, because they would not themselves get this, are not at a risk of a severe disease. And so I think maybe Liz or Jill might want to add something to that. No, okay.
Okay, you're on mute, Jill.
Yeah.
It all hangs, doesn't it, on how people manage the phrase immunocompromised, because the phrase is that vaccine will be offered to siblings of people who are immunocompromised. And we all know that children with Down syndrome are more susceptible to infection, but whether they cross that line and you call them immunocompromised or not, people will interpret that differently. And it's definitely something it would be worth us trying to clarify, I think, with NHS England and the thing. We could maybe do that outside of this.
I don't think so, because I think the college, everybody around the college felt that they wanted to be more inclusive, but did feel that the young person should be told about the risk of myocarditis as well.
But then parents can then argue, if it's agreed, then parents can argue to their GP that their child counts as immune compromised and they should get the vaccine. That's what you're saying. Okay. Yeah,
that's what I'm sort of saying, but it is a balancing act. And certainly I would like to send the message out that if their child is receiving any immunosuppressive drugs or cancer, then or happen to have a very severe additional neurodisability and recurrent sort of problems, really bad problems with the chest, then I would classify them as being immunocompromised and at risk. But the majority of our children are not severely immunocompromised per se.
Thank you. Now, I have two questions from the same person. Probably the first one was asked before you'd already answered it, but it's worth underlining again. How many children with Down syndrome but without any comorbidity have died of COVID in the UK?
No child has died in the UK with Down syndrome.
With or without COVID?
Without Down syndrome. I think there have been 11 deaths as far as I recall, but there were children with a comorbidity. So there's nobody who's died without a comorbidity as far as I know. There have been children who have had PIMS, and there have been children who have had long COVID, but I'm not aware of any children without any comorbidities who have died. I don't know whether Jill or Liz want to say.
Right. That's what the research showed. I agree. Yeah, that no one has died.
Right.
With or without comorbidities with Down syndrome.
Yeah, with Down. Yeah.
Nobody's died with Down syndrome.
Nobody's died. Yeah.
No, but in the typical population as well, whoever has died has had an additional comorbidity. The comorbidity also includes severe morbid obesity.
Okay, great. Now, from the same person, what if it is for a 12-year-old boy with Down syndrome with no additional health issues, so does a lot of sports and is not obese? Will the COVID risk be increased just because of having Down syndrome?
I'm afraid the research per se right now suggests that they are at an increased risk, but we don't know what that risk means. Talking about mortality in the first wave, the deaths that were there were in low-income groups. That's primarily actually India and Brazil, and the children who did the mortality was primarily related to children with very severe epilepsy and comorbidity, and the mortality rate was 1.3%. But it is as what going back to the initial thing that discussion, it is not the COVID-19 vaccine is being offered to prevent severe disease, prevent hospitalization, and having COVID-19, I've not had it myself, but when I've talking to young people, they get really bad headaches, high temperatures, and it's even if you're not hospitalized, it's not a nice condition to have. And so even our typical population without any additional needs, those young people who've had COVID have found it quite debilitating. They're not being hospitalized. And with a young person with Down syndrome, if they can't really express, we know that they sometimes can't express pain. So it is to prevent all those things that I would offer the vaccine. It is not that, or they're not at a big risk, so why should we get them vaccine? I think it is to prevent everything else, and the mental health issues, and not going to school, not being able to socialize, and everything, and all those other additional things. Liz, as a parent, would you like to add anything to that?
You're on mute.
No, I think that's absolutely spot on. Yes, we know that the risk of death is very, very small. Thank goodness. We know that no children with Down syndrome, with or without comorbidities, have died of COVID so far in the UK. We know that the vaccine can reduce your risk of serious illness, but also if it can reduce your chances of having to isolate, to take time off school, to feel rubbish, to perhaps end up with symptoms of long COVID, although we don't know a huge amount about that yet, then all of those things are positives. And if we're weighing up the pros and cons, we know that the side effects of the vaccine, those serious side effects, are vanishingly rare. And so I think those are far outweighed by all the bonuses of getting the vaccine.
Thank you. Now a question, can or could we just go to drop-in centres and expect our children, e.g. with Down syndrome and thyroid, to be vaccinated?
Sadly,
no, I've tried.
I think
and the reason behind that is because of all the training that Liz talked about. It's not just the training to give the vaccine, but it is safeguarding training, it is indemnity, it is the pediatric life-saving skills and everything else, that the additional training that's required, which is not provided to majority of the people that are sort of covering the vaccination centres.
Right, and this is to clarify, will siblings in the 12 to 15 age group be eligible on the basis of immunosuppressive aspects of their sibling who has Down syndrome?
So I think if the young person who has Down syndrome is definitely immunosuppressed, I don't think there'll be any question with that. So if they're receiving chemotherapy, or if they're on steroids or any other immunosuppressive drugs, I don't think there'll be any question. The rest of the population, I think, is a bit of a grey area, and I think every area will rule it out slightly differently and interpret it slightly differently. But I don't think there's any reason why one can't argue for that. But I do think at the time of taking consent, the college was saying that really the young person's consent should be taken, because under GILIC competencies, so they can't be they can't be forced into it either.
Now we are over time, but we have lots of questions.
Liz wants to add something to that, and I would like
it wasn't so much to what Sheila said. It was more, I've just been scrolling through some of the questions, and a few people have asked what a comorbidity is, and I do apologise, we end up flipping into talking in funny language, which makes us sound really clever. A comorbidity is just an additional illness that somebody might have. So somebody with Down syndrome with no comorbidities is otherwise fit and well, whereas somebody that has perhaps congenital heart disease or asthma, or perhaps a bowel condition or leukemia might well, we call that a comorbidity, that's all.
I was just going to ask you three if you're happy to carry on for a little longer, because there's still questions coming in. That's super. Are there any studies of longer term impacts of mRNA vaccines?
I'm not sure what does mRNA vaccine.
It's the type of vaccine that they're getting. It's the new. It's this relatively new technology for vaccines. In children, I don't think there is a lot of long-term interest. Pfizer is a relatively new technology. I think there's no reason to expect, though, that it will cause problems from people looking at the vaccine. And one of the things that's always reassuring, of course, is that the vaccine was given to millions and millions of very vulnerable elderly people first, and almost 8 or 9 months ago, and we've not seen any vaccine effects. We're very lucky in this country that we have a really good yellow card system that is recording any side effects or any problems with the vaccine. And to show how good it is, we've managed to pick 12 per million cases of side effects. So it shows you it's very sensitive, and people are looking at it all the time, and they're published, the side effects from yellow card system, and people look whether these things occur more than you would expect or not. So I think we can never be 100%, but I think it's pretty, I don't think any doctors are worried about this from what they know.
I think you've answered the next question, which is about side effects specifically affecting children with Down syndrome from vaccination.
I don't think we'll have the answer to that, but I'm going to put in a plug for the T21RS group, who are undertaking a research study onto the effects of COVID-19 vaccination, as well as seeking out the opinion of parents if they are choosing not to have the child vaccinated. So either way, and I will over the weekend put that up on the DSMIG website, and I think the DSA also might have a link for that. But that they are looking into that, and not only in the UK but internationally.
Thank you. There's a question from a parent who has a 13-year-old son with a long list of comorbidities and who is non-verbal, and she's asking what symptoms to look out for pericarditis or myocarditis after having a vaccine.
So the biggest symptom, particularly in those 12 per million, was chest discomfort. So however your son will normally let you know that he's in pain, those are the things to watch out for. It is, as we've said, though, incredibly rare, and those cases were all very mild and didn't need any real intervention or treatment. We tend to treat them with painkillers and anti-inflammatory medications. So it'd be watching out for any signs that he's telling you that he's in discomfort. So the normal ways that he'd let you know that he was in pain.
Yeah, I appreciate it really hard, but as a parent, I think you would be very intuitive and you will know that something's not quite right. You might be overcautious, but I think it's better to be overcautious than sort of just. I still think that it's even though your child can't communicate verbally, all the more reason why I would say you should offer the vaccine to him, because it'd be really hard if he were to become unwell.
Okay, the next question is from the parent of a 14-year-old son who has mosaic Down syndrome and no underlying health conditions. And her GP has told her that her son has the same risk as a neurotypical child his age. Would you recommend this vaccine to a typical 14-year-old without Down syndrome?
When we are offering it to the siblings of children who have Down syndrome, so the question about whether you would offer it to a typical person, young person over the age of 12, that was the answer for that. But I guess with mosaic, there's been a big discussion, and when I've discussed it with our genetic doctors, mosaicism is. We would still say, so we still offer the thyroid surveillance, for example, to all children who are mosaic Down syndrome. So we don't know enough. And if something can protect your child, I would sort of say they can. And I would suggest for you to request your pediatrician to provide you a letter of support to get the vaccine, because the mosaic also depends on how many cells are in the mosaic things, and is it the body cells, which cells are mosaic? It's just quite an unknown quantity as far as I'm concerned.
Yeah, I would agree, absolutely. I think you should still have the vaccine if you have mosaic Down syndrome, and talk to your paediatrician, because I'm sure they will agree with you, and I'm sure they'll recommend it.
Very helpful, thank you.
You can quote us.
Somebody has asked a question of their CCG and have been told it's not in their planning for the next 3 weeks for 12 to 15-year-olds, so it will not happen before the 23rd. I think we've been hearing that too through the helpline, which is disappointing, because its original information was 23rd at the latest.
I think the advice actually says that they will start the program at 23rd, but they should receive the letters by the 23rd. And I think CGs have interpreted it differently, that they should start sending the letters out from the 23rd rather than have sent out their letters by the 23rd.
Again, there's so much variation, isn't there? The CCG that I live within has said the same thing. They don't have any plans at the moment. They're still trying to make plans. But the CCG next over is well into their plans and knows exactly what they're doing. So there is an awful lot of variation. So I don't know what Gillian's suggestion is, but I think I would keep in touch with them.
Yeah. Well, that's the next question. If I don't hear anything on the 23rd, should I simply wait for my GP to contact me, or should I go somewhere, log on somewhere?
Unfortunately, I'm going to call with my mum hat on, and not my DSMIG hat on. Unfortunately, the people that shout loudest get heard. So I would absolutely say to continue advocating for your child and keep making a nuisance of yourself.
Absolutely.
Yep. Do you know?
Apologies.
No, absolutely. I do that. I definitely would do that.
Yeah. Do you know if they're looking to test the vaccine for children under 12? My son is 10 and has siblings aged 12 and 14. I'm concerned that none of my children are being protected, particularly protecting my son the best we can. So under 12s.
I think they're doing some work in America for the 6 and above, and they did do some work on the Johnson & Johnson vaccine, but I don't think there's enough known, and I think the moment that we know something more, they will. It is just weighing up that balance about taking the risks, and because the studies actually did suggest the risk for getting COVID symptoms was the most above the age of sort of 14, actually. So that's what they haven't extended it to the under 12s.
Okay, who should we speak to in a local area to find out what's happening? In Hertfordshire, I cannot find the right person to ask. Paediatricians don't know, GPs don't know, left messages with PALS and local PCT. We've now written to the MP to at least try and find an answer about what the plan will be.
It should be all happening through GP surgeries. So I would get in touch with your GP surgery. And then from there, it should be escalated to the CCG. The paediatricians, I'm sure, would love to be doing this, but unfortunately, they're not in the loop.
Thank you. And a comment from South Wales. Here in South Wales, young people 12 to 15 classed as moderately clinically vulnerable are being contacted, and we are taking our son to a vaccination centre. Thank you for that. Are we allowed to go out of area if we find there's a centre that can do us?
Adults can. So I don't know. I have tried again with my daughter and not been able to get to a walk-in centre, but I know that adults have gone out of area to get vaccines at times that are suitable to them. So I imagine it should be possible, but I don't know the technicalities.
Yeah.
Now we have a question about a topic that's emerged to us this week, and perhaps to DSMIG before this week, but we haven't spoken about it so far, but will be very soon. It says, with RSV vaccinations about to start, and I'll ask one of our guests to say what those are, I was wondering what risk, if any, is posed to babies from COVID, and whether there's likely to be any babies, especially those with additional vulnerabilities, on the list for the COVID vaccine anytime soon. So do you want to start with RSV?
So that's respiratory syncytial virus. It's a common virus that causes breathing difficulties in children. When children have had a really rocky start in the neonatal period, they're offered a vaccine against this often, so that's that. I think the evidence so far is that babies and small children are not affected very much with this at all. And so there's really I'm not aware of knowing any babies who've been admitted with COVID or sick. Maybe you know some, Liz, you can talk in a minute. But I think at the moment, they're going to really be the last group to be vaccinated. And I think the most important thing is to get all the other vaccines for the baby, because there are some risks that the fact that we've all been indoors for a whole year has had some effect on the way the infections work. And so people are worried that this winter there will be more RSV and more flu and more other infectious diseases than there would normally be. And so having the other vaccines for a young child is even more important than normal, and that's much more important than getting COVID. Now, Liz, sorry, were you going to add to that?
No, I completely agree. I, in my day job, and an A&E doctor working in a children's A&E, and I've got links with other A&E doctors all over the country. And although we have seen children, babies, infants with COVID-19, they're not particularly unwell. Those that are more unwell tend to be older. But what we are seeing is an awful lot of other respiratory illnesses in those children, particularly those children that have been locked down for a year, not come into contact with any illnesses in that period. And now all of a sudden we're mixing, and so those other illnesses are going up very, very quickly, and we're seeing an awful lot more other respiratory problems. So yes, it is possible to catch it if you're tiny. No, it's unlikely that you're going to get really unwell. You're more likely to get unwell with other chest problems. And as Jill says, absolutely, normal childhood vaccinations should be going ahead. And obviously, if you're uncertain, see your GP. But the vaccination hasn't been tested in that smaller group yet, and they're not particularly at risk of COVID.
Thank you. Now, some of our guests have to leave now. Is that you, Sheila? Are you going to have to go?
Yeah. I just sort of to add to the last thing, the T21RS study with children, only 4% of children less than the age of 1 were admitted to the hospital. And the young person that was admitted, I know, had very severe epilepsy as well, very bad lung disease as well. So, and so even though it says 4%, but I think it was only one child that was hospitalized. So I think children under the age of 1 are at a very, very low risk, extremely low risk of COVID-19. And under 2 also a very, very, very low risk.
Right, I'm really sorry, I'm going to have to bring the session to an end, but I'm going to pick one more question. Others, please, email us email to the Down Syndrome Association, and we can refer things on to DSMIG if we're not able to answer them ourselves. But one more question, guidance for treating a young person with Down syndrome with COVID in the event they're admitted to hospital. Is there any guidance? For example, will professionals be reminded that they should aim for the same SATs levels, but have a lower threshold before moving on to an oxygen protocol, etc.?
So the mainstay of treatment for COVID-19 is primarily symptomatic and looking at what the symptoms are. But I think the issue really is about communication and communicating with the young person to let them know what's going on. But otherwise, I would have said that there'd be the same standard for the oxygen levels and everything else. But we do know that children who have Down syndrome can present atypically for infections per se. So it might be a bit harder. And so you might have to detect that they are going downhill. So I would say Liz has done a fantastic poster about children with acute infections and sort of trying to look at their signs and symptoms. So as a parent, you know when your child's not well, and you need to fight their corner and say, this is not my child, because sometimes, unfortunately, professionals assume that a child's just quiet because they have Down syndrome, but actually they're quiet because they're not well. And you know that. So you need to fight the corner to sort of say, but the medical standards would be the same for anybody. So if we're using the cutoff of, say, the saturations, normal saturations, definitely they need oxygen. Say, for example, if the saturations go less than 94 or 95, that cutoff would be the same for a child with Down syndrome or without Down syndrome. Would you say that's right, Liz?
Yeah, we're actually using 92 at the moment, and that may drop. There's recent changes in around bronchiolitis to suggest that we can actually use a cutoff of 90%. So we are going to find more children that don't need oxygen because of the new guidance. But that's Down syndrome, not Down syndrome, everybody. But yeah, no, I completely agree. And by all means, thank you for the comment about the poster. Take the poster in, show them. Yes. I know lots of people that do. I've even though I wrote it, I've stuck it up all over the wall at work and things as well to remind people. Absolutely, advocate for your child. You know when they're not well. You know when they're not themselves, and people should be listening to that.
Well, a very big thank you to our guests from the Down Syndrome Medical Interest Group. I think we would like to do this again. We have many more questions. I'm sure we'll do it again. And do feel free to leave if you wish to. I have one more slide to show, which is not about vaccinations, for people who want to stay to just have a nice positive for the end of the session. So I'm going to share the very last slide here and pass over to Kate.
Hi everyone. Just to close off our session today, oops.
There we go, sorry.
I just wanted to let you know, well, remind you perhaps, Kate Powell and Vinny Kapoor, our colleagues, two of our colleagues who have Down syndrome, are regular bloggers on our website. Kate in particularly does an almost weekly blog for us. You can find them on our website at the URL at the top there. So it's downs-syndrome.org.uk/news/category/r-voice-r-stories. And this week's blog post from Kate, when we tweeted about it, actually got retweeted by the government's disability unit, and they have over 115,000 followers. So we just wanted to highlight that and say thank you to Kate for all her marvelous blogs. And you know, it's fantastic that we're able to you know, we can amplify your voice and the voices of other people who have Down syndrome. And definitely read Kate's blogs if you get the chance. They're always fantastic.
Well done, Kate. Well, big thank you to everybody. There's been a question about the recording. We have recorded, provided that's worked properly. Yes, we will put it up for a limited time until it's out of date. And thank you for the many thanks that are coming in to everybody who's participated in the Q&A box. Thank you very much.
Keep positive and keep safe.
Thank you all. Thank you.
Thank you.
Okay, thank you.
Bye.
I'll close the session now.
Bye.
Bye.